Imagine a health crisis so prevalent it strikes someone every 40 seconds in the United States alone. This is the stark reality of stroke, a condition often associated with aging but increasingly affecting young adults, even those in their 30s. Gone are the days when stroke was considered a disease of the elderly. It's a wake-up call for all, young and old. Strokes are steadily rising among young adults, a demographic often unaware of the looming threat. The implications of this trend are significant. Strokes can lead to long-term disability, impacting the lives of young adults in their prime. Ignoring this issue is no longer an option. It's time we address this growing health concern head-on. This essay will delve into the different types of strokes, explore the risk factors contributing to this alarming trend, and provide practical tips for prevention. Knowledge is power, and in the case of strokes, it can be life-saving. To combat this silent threat, it's essential to understand what a stroke is and how it affects the brain. Strokes occur when the blood supply to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. Two primary types of strokes demand our attention: ischemic and hemorrhagic. Ischemic strokes, the most common type, occur when a blood clot blocks an artery supplying blood to the brain. Hemorrhagic strokes result from a weakened blood vessel rupturing and bleeding into the brain. Understanding these different types is crucial for accurate diagnosis and effective treatment strategies. The consequences of a stroke can be devastating, ranging from temporary weakness to permanent disability and even death. The severity of these consequences depends on various factors, including the type of stroke and the time elapsed before seeking medical attention. The alarming rise of strokes among young adults is a complex issue with no single cause. It's a confluence of traditional risk factors, modern lifestyle choices, and unique vulnerabilities specific to this age group. Traditional risk factors, often associated with cardiovascular health, play a significant role in stroke risk for all age groups. High blood pressure, often called the silent killer, damages blood vessels, increasing the likelihood of both ischemic and hemorrhagic strokes. Diabetes and elevated cholesterol levels contribute to plaque buildup in arteries, increasing stroke risk. Obesity, often intertwined with high blood pressure, diabetes, and high cholesterol, acts as a compounding factor, exacerbating these risks. Section 4. Turning the tide: prevention strategies for a healthier life. The good news is that many of these risk factors are modifiable, empowering young adults to take control of their health and reduce their risk of stroke. Embracing a healthy lifestyle is not just a choice, but an investment in a longer, healthier life. Focus on consuming a balanced diet rich in fruits, vegetables, whole grains, and lean protein sources. Limit processed foods, saturated and trans fats, and added sugars. Regular physical activity is another crucial aspect of stroke prevention. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week. Incorporate stress management techniques into your daily life, such as meditation, yoga, or spending time in nature. Section 5. Recognizing the signs, taking swift action, your guide to stroke response. Time is brain when it comes to stroke. Prompt medical attention is crucial for improving outcomes and reducing the risk of long-term disability or death. Recognizing stroke symptoms and seeking immediate medical help can make all the difference. The BEFAST acronym is an easy-to-remember tool for identifying stroke symptoms: balance, sudden loss of balance or coordination; eyes, sudden vision changes such as blurred vision, double vision, or loss of vision in one or both eyes; face, the one side of the face drooping. Ask the person to smile and see if one side of their face droops. Arms, weakness or numbness in one arm. Ask the person to raise both arms and see if one arm drifts downward. Speech, difficulty speaking or slurred speech. Ask the person to repeat a simple sentence and listen for any difficulty speaking or slurred words. Time to call 911 immediately if you or someone you know experiences any of these symptoms. Every minute counts when it comes to stroke. Call 911 or your local emergency number right away and clearly describe the symptoms you are experiencing. By learning the signs and acting quickly, you can potentially save a life, your own or someone else's.